Yeah, so healthcare is all about trust, right? So we are, like I said, we are being surrounded by physicians, but trust is super critical. One unique thing on ColigoMed side is we are not only just administrative AI in the healthcare, we have both clinical AI as well as the administrative AI. So within ColigoMed, the clinical insights that our AI generates never go to patients directly. So either our clinical team, where we have a large clinical team, or our customers' clinical teams reviews first. That means human in the loop approach is there that provides clear governance as well as, it's our folks are validating it before it exposes to the patients. That is critical until, there is more AI regulation, healthcare regulation is there to that governs, right? So here we are self-governing it. So
Interesting.
another big lesson, my experience with running other startups and all, is that we don't build anything without a signed customer. More importantly, that is critical in healthcare because you can build all the things you want, but if it is not validated in a real life clinical settings, then it takes longer, right? So for everything that we do, we have a signed customer where they act as a design partner for us.
Definitely, definitely. You might have heard me like talk about it multiple times. The philosophy that you follow, I also follow is sell it, demo, build instead of like build, demo, sell. I think that keeps us grounded around what they are looking for. Going back to the point that you mentioned about trust and quality, help us understand a little bit more. Like I understand that you have human in the loop, you have RLHF and everything, but let's let's look at the big picture in healthcare. How should one go about building trust? How should we improve, or how could we improve quality in healthcare? How can we validate or stand by the accuracy of the platform? And then how do you track it? Like, what are the key KPIs? What are the key milestones? How do you track success? How do you track progress at
Yeah,
ColigoMed?
Yeah, one of the things that we have is that, like I said, it right, our clinical team is there, and we have a telehealth natively built into the platform. That means every interaction with the patient is tracked within the system. That means nothing goes outside of the system. So what we started doing is that, so we have a strong AI team, but wherever the things are needed, we rely on our other folks also. That's where JP, you and I've been discussing on building, the auto audit, right? That means all the calls are randomized. We do have a full-time clinical leader that audits randomly. She sits on the calls, um, not letting our clinical team know in advance. She randomly picks up, okay, what calls, because she knows from our dashboard, she can see what calls are going and all, right? All the text interactions.
Yep,
So
yep.
we, to scale it, and we are wanted to partner with you where you are saying that, hey, you would like to build the trust and quality as not afterthought, but it's the first principles. And that's what we are looking at.